Hi, welcome to Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and General Surgeon here at UH Conneaut Medical Center. Doc, how you doing today?
Oh gosh, Pat, beautiful day.
Yep.
I think we had enough rain.
Yes, we have.
I think if it warms up, things are going to grow audibly.
I think we got about a week of this cold, rainy weather, and then everything should be into summer mode, I hope.
We all hope.
I see you got guests today.
Well, Pat, Denise Brown, who is here with us today, has been very, very helpful to this show in general. And really, she has been the one who has arranged the show today. I'm going to let her introduce our guests, and then we'll get started on what I think is going to address some very, very important topics in our community. So, Denise, why don't you go ahead?
Thank you, Dr. Bryant. As I discussed previous times when I was on the show, I'm the hospital-to-home nurse for UH Conneaut and Geneva medical centers. And when I go into the home, not only is my focus the patient and family's health, but also their safety, and if there's any resources that I can help them with in the community. And through my work, I have been able to come in contact and work with the wonderful organization of Adult Protective Services. And I'm honored today to have Ms. Beeman and Mr. Arcaro here with us today to discuss the Adult Protective Services, what services they provide, the importance of safety for our elders, and the Senior Levy that is a great means of support for these programs and the services we can provide our community. Ms. Beeman.
Thank you very, very much, Denise. Why don't you tell us, if you could, and just briefly tell the public who you are and how you got here, and how you wound up taking care of our community.
Well, I'm Linda Beeman, and I work for the Department of Job and Family Services in Ashtabula County in the Social Service Division. And Adult Protective Services is just one of the social services that are administered through the county department. And I've been with the department in Adult Protective Services about 13 years. I supervise 2 home visitors who actually go out and are in the homes and actually have the true interaction with our seniors when we do get a referral.
Okay, so that's terrific that they visit the home, and this is based on referrals.
Yes.
And who makes those referrals?
Well, those referrals can come from anyone who has a concern for a senior who's living in their own home. It can also come from folks who are considered mandatory reporters, and those are doctors, senior service providers, police officers, anyone who works really closely with seniors, but there are some that are mandated under the law.
Very good.
Now, if somebody, say a community member, sees a concern they want to report, but sometimes people are hesitant to get involved or have their name exposed, can they anonymously make a report?
Yes, they definitely can remain anonymous. We do have a hotline number here in Ashtabula County.
We will have that number, and it will be showing at the bottom of the presentation when this actually airs.
And they can call the number. It's actually available 24 hours a day. They can leave a message, and there's also a way to get a live person even after hours. But we would ask that the person who makes the report just have basic information about the individual, an approximate age, because Adult Protective Services is for folks who are 60 years of age and older, live in the community, and that are at risk for some reason, have some risk involved with what's happening. It could be something that just happened suddenly or something that's been coming on over the course of time. So we'd ask for the referral to be, give us a little background information, where the person lives, whether or not they know if the person has any family members locally or maybe sees a doctor or has some sort of medical provider.
Very good, very good. Pat, perhaps you could introduce yourself and give us a little of your background.
I'm Patrick Arcaro, and I've been director of the agency for 13 years now. Born and raised in Conneaut. Prior to coming to this position, I was with Cuyahoga County government in their workforce development division as a senior administrative officer. Spent some time with a national chain of assisted living homes where I was their director of community services. My role at the agency is basically to make sure everything is going the way it should. We administer over 100+ programs at Job and Family Services, everything from child support to workforce development to food stamps, Medicaid, workforce and economic development, and of course we administer the Senior Services Levy on behalf of the Board of County Commissioners.
You must have at least some kind of a relationship with the United Way program, Dial 211.
We do. They're actually one of the ones that we fund. We give them money to help keep that program going.
Wow,
Through
that's
community
terrific.
action, and we make a number of referrals to that.
Yeah, we had a director from that program on this show at one time, and I have to admit I really didn't know too much about it, and it was very impressive. And it sounds like you two would be able to work collaboratively, obviously.
Yeah, we like to say at Job and Family Services we touch every life in Ashtabula County one way or the other, because either somebody in the community is receiving services or they know somebody who's receiving services. So we're a catch-all for just about everything.
Well, what kind of calls relative to the elderly are generally the most, would you say, are the most common?
The most common are calls concerning neglect, and it could be neglect of medical needs, neglect of basic needs, you know, housing, food. Sometimes it's neglect that is self-neglect, considered self-neglect because the elderly person just isn't providing for themselves or able to provide for themselves, or sometimes neglect by a caregiver, and that someone is supposed to be providing care and just isn't, whether it's intentional or not.
Please.
What about, say a senior is in need of medication? Are you allowed to give that to them? Because there are certain agencies that are not allowed to.
Correct. We would arrange for services if that was one of the services that was needed, and that's one of the benefits of having the Adult Protective Services involved with someone is that we really do have an awareness of a lot of the services in the county, or we know who to go to. And we would, you know, go to even the hospital home program. We would go to that individual and say, look, somebody needs help with medication administration, or just organizing the pill bottles, the pill containers, and then we look for that resource out there.
Are you on call, like, not you personally, but your staff 24/7, or how does that
The
work?
hotline number is, right?
The hotline number is,
Okay.
and we're there Monday through Friday to 4:30. We do have a message. You can leave a message on the hotline, or then the state also has arrangements so that the number would also roll to someone who would answer it, such as at 211. And then based on whether or not they considered it an emergency or not, it would be acted on within 24 hours if it's an emergency.
Okay.
Well, I think that's obviously a very important point, because it's certainly not uncommon. We all know it on our side of things that compliance with medications is crucial, and there's plenty of ways for that to get slipped up. I mean, people might not have their medication. They might not remember how they're supposed to take it. I mean, there's lots of things that can interfere with that. And so I guess what I'm hearing is that, and what people out there I hope are hearing, is that you don't have to get stuck in that position. You absolutely do not. I mean, you can. There's numbers that you can call where people will help you, so that you can be taking. You know, I'll give you an example of what I mean. There's a lot of people that are on what are called beta blockers, and that's a heart medication, a blood pressure medication. And after you've been on it for a while, if you just suddenly stop that medication, it's very dangerous. Okay, that would be classified as an emergency. Okay, so this isn't something that can be sort of, well, maybe tomorrow or maybe the next day. Taking your medications is very, very important, and as you're hearing, there's help for you to make sure that that gets taken care of.
Along the lines with the compliance with the medication, also like physician appointments, you assist with transportation, setting them up with meals, things such as that, also kind of like the whole picture so that they're fulfilling all their needs that they have.
Yes, based on the investigation, when we do go out on a referral, then we do a risk assessment. So we look at what are the things that are putting this person at risk of not being safe at home. And one of the most important is to be able to get where they need to go to get their medical care. And that is through the transportation. And some of the hospitals offer some transportation. We have some transportation through our Senior Services Levy. We have some funding through Title 20, which is through the state, that also offers some transportation. And we have some volunteer organizations that also will do that.
Our agency still also administers the Ashby County Transportation System. So you might see an ACTS bus that travels around Conneaut or wherever, but that falls underneath our purview, so we work hand in hand with that as well. And actually one of the things that we offer through ACTS is we pay from the Senior Services Levy, the seniors ride free on a particular day between the hours, I don't even remember the hours. I think it's 7 to 11 on Wednesdays.
To get to appointments.
Yeah.
Excellent.
But it's a demand response system, so we can actually go to a person's house, pick them up, and take them to their doctor's appointments and things like that.
It's wonderful. That's one of the main challenges I see when I go in the homes is transportation.
Transportation is huge.
One of the top ones, so that's fantastic.
What about Alzheimer's in that situation? Is that something that you address? Probably, because seniors do get Alzheimer's.
Could I pick up on that for
Sure.
just a second? One of the most difficult situations that families get into is when somebody is developing Alzheimer's and they're in the fairly early stages of it. If somebody's in the higher stages of Alzheimer's, well, that's obvious, you know, and they need. But there's a transition period that people go through where I think they're particularly vulnerable, because the individual involved may not realize the extent to which their capacity has been diminished. The family, it's very strange what's going on. It's very unsettling what's going on. They want to hold on to things the way they were as long as they can. And people can get to the point where they are at risk and they don't know it, or they're even defiant about it, and the family is in denial about it. And that would seem to me to be a particularly difficult situation, yet one where perhaps some of the most effective intervention could come. Now, again, you would not get involved in a situation like that unless there was a referral.
Correct. We would need to have a referral. And usually it is from a family member or someone who is close to the family. Many times, as you said, these symptoms come on gradually,
Yep.
or they may only manifest in the evening.
Mm-hmm.
And then even when we go during the day, of course, we're going to go and make our home visit during the day, and the person's fine. I don't need any help. I haven't seen a doctor in years, but I don't need anything, and they are very good. But we know through experience and through the referral that there is something going on.
Why is it the evenings you notice it more? I never heard that before.
Hopefully the doctor can explain a little more.
Well, stimulation goes down in the evening, okay? And a lot of times it's stimulation that holds a person in their environment and gives them cues and that sort of thing. And you know, their metabolism changes somewhat in the evening. Hormonal levels change in the evening. They're cyclical. But it's mostly the stimulation. Now in the hospital, it's a different story. We have something that all of us know well, it's called sundowning, and it's very, very common. It's very, very unsettling for families, particularly in the intensive care unit. You'll have somebody who's in the intensive care unit. Their rhythms are all disturbed. There's sounds, there's lights, there's people coming in and out at all the time, and so their sleep cycle is disturbed. But particularly in the evenings, it's these people who can be completely lucid during the day, respond appropriately to questions. You think they're pretty much they're fine. In the evening can become completely disoriented, don't know where they are. I mean, it's just obvious that what appears to be very severe psychological event has taken place. And yet, once they get better and once they get home, they almost always go back completely to baseline, completely to normal. So you see it, and oh man, this looks terrible, something terrible has happened, and then it just kind of disappears. So sundowning syndrome is well known to us, and this is
Never heard of that before.
what we're talking about is
Wow.
probably akin to that, I would think.
You know, back in the 70s, my grandmother, on my mom's side, and you know, back in those days, Doc, you remember that they didn't really talk about Alzheimer's. I don't even think they just even knew what it was that much. And she was in her late 70s, and she became to the point where she never talked. She could just quit talking and would just stare. And we'd talk to her, and here was a lady that was very, very friendly in her normal life, just went into outer space and just wasn't the same person anymore. And back in those days, we didn't understand what was happening. And now, as Doc and I have discussed over the years, we are more educated, obviously, with this particular disease. And it's a very sad disease.
It's absolutely devastating.
It is. It really
Basically,
is.
you lose the person you know while they're still here.
Yes. Yeah.
Yeah, it's
Very, very
unbelievable.
sad.
It's very, very sad. It's very traumatic for families.
Mm-hmm. Yeah.
Yeah. Well, I think the point for people listening to this program is that this does happen. Alzheimer's frequently does come on gradually, and there are clues, and neglecting it, hoping that it's just temporary and that it's going to change, it turns out that can be quite dangerous, because as the disease progresses, people really do get disoriented, and they can get themselves in very serious trouble pretty quickly without even realizing it. And you certainly don't want to wait until it gets to that point. So you're not doing a disservice, you're not being a busybody, you're not overstepping if you really have concerns about a family member or about people that you know, and you could be providing, actually, in reality, a potentially life-saving bit of support by getting the appropriate people involved, by getting adult protective services involved. It's not punitive; it's supportive, and you can get the help you need, the assessment you need, so that these things get handled in a safe and the most appropriate way. So you should not hesitate about that. People need to be vigilant. The population is aging. Not Pat Williams and I, we don't age, but
Right.
the rest of the population is aging, and these issues are going to become more and more frequent, more and more common.
I didn't want to interrupt. Now, we had mentioned a little bit at the beginning the Senior Levy. Can you kind of explain a little bit about that, Patrick, and how the impact that has on these programs?
The Senior Levy is a 5 mil property tax levy, which was originally passed back in 2000. And it's been renewed every 5 years since then. And it offers services that are available to anyone 60 years of age and older. And they're geared towards keeping individuals in their homes. And the 5 mil generates roughly around $1.7 million a year. And the majority of that, actually, we were talking about transportation, the majority of that goes into transportation. Actually, the in-home care side of it, which would be transportation, chore, homemaker, the home delivered meals is a big one, and personal care. And those services are provided by other community service agencies in the community that we contract with through the Senior Levy. And APS is part of it, Adult Protective Services. But we see a lot with meals, and we see a lot with transportation. And the meals is an important part because really that's, when we talk about people who have dementia or at home by themselves, you know, the person who's delivering that meal is really the only type of interaction they get during the day when they're home by themselves, so they don't have anybody else with them. But it really is a great program, and it's actually a community partnership, we like to call it, because the community gets involved in other areas, and just without the support of the community, we wouldn't be able to pass that every single year, or every 5 years that it comes up for renewal.
When does it come up again? November?
It was just, I think we have 3 years left.
Three?
Yeah, it was
Okay.
just.
Wasn't
actually-
on yesterday, was it?
No. The last one was a replacement, actually.
Okay.
Because it was renewed every year, and then the last one we had to go out because the amount of services we were providing was falling short of the money that was there, so. With the replacement, it generates about another $300,000 worth of services that we can put back in the community.
If I can just, everybody has their own political views and this and that. In my view, I mean, this is what communities are all about, okay? This is the community taking care of its own.
Mm-hmm.
And is a very, very, very important thing. My wife was involved in delivering meals as a volunteer for many, many years, and she could tell you firsthand the impact that program has on these people, because just think about it. The only person that person sees. They're home alone. It's very tough for them to get out. A lot of times they can't get out, okay? And they have no family in the area, and they have no human contact. And so when the person comes in and brings them a meal, she would always spend a little time with them. You know, she knew who their grandkids were. I mean, it was just one of the most fulfilling things that she could have done, and it was just crucial for those people. There's no question about it. So when we talk about the Senior Levy, that's what we're talking about, and other things, of course, but that's what we're talking about. So
We don't have the numbers for 2016 because they haven't been compiled yet, but in 2015 we provided 55,000 meals.
oh, that's
Wow.
that's enormous.
I remember when we did the AM Live show back on television here, and I think it was a couple years ago. Maybe Patrick, you were on to promote the levy at the time, and had a guy call in. It's a regular caller, but he was against everything, and he was against the senior levy. And I remember telling him, one day you're going to be a senior citizen.
That's right.
And it's going to happen, hopefully, to all of us.
Right.
And you have to support this kind of stuff. I could not convince him.
Aging is universal.
Absolutely, it is. It is. So
We were
this is a
talking
great
about that this
program.
morning. I was talking about I had to get new shoes because my feet were killing me.
Yours too? Well, mine too. Yeah, it's a great program, and I highly have endorsed it all along. So continued success. I mean, you do a great job, Patrick, and your staff.
It's passed by 70-75% margin every single time it's been on the ballot.
Okay, well, so people get it.
Mhm.
People understand.
Right.
Well, because it's nice not only for the person who needs the services, but also for the family members.
Sure, absolutely, of course. Matthew, I think you had a question?
Yeah, what is the minimum age to be considered a senior to get the help? And what is that emergency fund number? So that people will be able to write it down, plus we'll show it.
For adult protective services, the law is for folks who are 60 years of age and older. We can provide some services for folks who are younger than that, over 18, but under 60 if they're disabled. So we can come in and help arrange services, but it's not so much under the law, but that's under some funding that we have. But the number here in Ashtabula, of course, is 440-997-7777.
There you go.
Okay, and that would get to either me or one of the Adult Protective Services workers, so that we do answer that, or they can leave a message.
And technically, isn't a senior citizen now 55? Is that what they're saying?
Depending on what program
Right.
Really?
you're under, it is. And,
Yeah.
and for some, of course, it's 65, but.
Right. In the old days, it used to be 65, I
Right,
think.
and that's actually something we struggle with because the minimum age to receive services through the senior levy is 60.
Mhm.
But we see a lot of individuals who are, like myself, who are 60 and don't really need the services.
Right,
So
right.
we're actually looking at possibly raising that age because there is such a demand and people are more healthy, as I'm sure the doc can speak to, and have more longevity. So that's something we struggle with every time we put the ballot language back on for the senior levy. But currently it's 60 years old for the senior levy as well.
Okay, good deal.
I would like to just touch on this briefly while we still have some couple minutes left. I'm just going to ask it. How prevalent is elderly abuse in this community?
We get about between 250 and 300 referrals a year. And with every one of those, we make a home visit. Sometimes many more than just the one. You know, we'll attempt 3 times. So if someone's not home, we'll attempt 3 times. But you know, it's not a high percentage, but those are the ones that are brought to our attention. I'm sure that it's more prevalent than that because it is a hidden abuse. You're in your home, and your isolation is one of the biggest risk factors for being abused or neglected. But we do get, you know, referrals from many sources. We said many are from family members and many from the medical community.
And one thing I will point out, Doc, is the funding for APS is horrible. On a state and federal level, it's horrible. So without our senior levy, we probably would not be able to provide the services that we provide with APS. Because it does help to fund the 2 positions that we have. We have two investigators for 702 square miles in Conneaut, or in Ashtabula County. It's obviously the largest landmass in the state of Ohio.
Yep.
But over the last several years, the allocation that we would get for those services was around $4,000.
Oh, come on.
So recently, we've got an increase. So it's up to about $30,000. But again, without the senior levy, we wouldn't be able to do half the things that we do. So that's something to keep in mind when you're talking to your legislators and things like that. It is a very important program, and there doesn't seem to be a lot of support on the state and national level for that.
And when you talk about senior abuse, are we talking mental and physical abuse? Both?
Yes, that is part of the what the law considers abuse. It can be physical, mental, emotional, of course, sexual abuse. Exploitation is another component, and that is using someone's resources for your own, you know, benefit and not helping the senior. And then, of course, but that definitely is part of that.
My goodness. Well, I would like to really thank both of you for coming. I get the feeling that we could do 3 or 4 more shows and really not even cover everything that needs to be covered. But I think that today at least the public gets a chance to hear it from you, what really is going on, what's really available. That number is available. You should be seeing it at the bottom of the screen. And there is help available for these very, very difficult situations. And so you're not alone, and if you have questions, if you have problems, even if you wonder whether or not this applies to you, you can talk to people down there who will help guide you through the conversation so that you understand a lot better. So we would really like to thank you very much for taking the time and coming and talk to our community today.
Thanks for having us.
Thank you.
Very informative. Folks, thank you for watching, and we'll see you next week. And remember, your health matters.